Hello dentist, how are you today? I hope you're fine. Today we're going to talk about necrotizing ulcerative gingivitis. What is acute necrotizing ulcerative gingivitis? It is a common non-contagious infection of gums with a sudden onset. They are painful and there is bleeding gums and ulceration of the interdental papillae. Can you see here? Look at this slide. Here, this is the interdental papillae between the teeth. This is, we call it interdental papillae. There is ulceration here. And of course, the gums are painful because of the swelling, okay, due to infection. And then also the gums, they bleed on brushing or maybe by itself like this, okay? Okay, so this is how we can diagnose acute necrotizing ulcerative gingivitis. Let's look the other slide. What are the organisms that are implicated? So the organisms that are implicated, mixed picture of fusospirochetal organisms, gram-negative anaerobes including Porphyromonas, Treponema species, Selenomonas species, and Provotella species. Okay. So can you see now, here we have, this is an interdental papillae. Can you see? This is the interdental papillae and the swollen gums are seen very clearly, okay? And there is infection, of course, all around us and calculus in between the teeth. And of course, we can see it with a mirror, better with a mirror. Clinical features of necrotizing ulcerative gingivitis, okay? It's painful, yellowish white ulcer. Initially involves the interdental, so it starts with the interdental papillae and then spreads to involves the labial. This is the labial marginal gingiva. So it starts with the interdental papillae and then reaches the labial marginal. This is called marginal gingiva, okay? And then also it involves the lingual, which is here at the back of the teeth, the lower centrals. We call it lingual marginal gingiva. We can see it with the mirror at the back of the teeth. Also, we can patient feels metallic taste, regional lymphadenopathy, of course, because there is infection, okay, and then fever, of course, malaise. All these are common features of any infection, okay. Lymphadenopathy, lymph nodes, swelling of the lymph nodes, fever, malaise. Poor oral hygiene, of course, you can see here, this is a very good picture of a patient who has a very poor oral hygiene and he has necrotizing ulcerative gingivitis, okay, due to the here you can see here the calculus around under the gingiva, okay, you can see it clearly under the gingiva. Okay, so this patient doesn't brush his teeth properly. So poor oral hygiene, very poor oral hygiene. Okay, he doesn't brush his teeth. Sensation of teeth being wedged and fetor orals. So we advise the patient, of course, to brush his teeth properly by using the brush. Okay, especially in this case, he will use a soft brush in order to prevent bleeding, a lot of bleeding. Okay, because his gingiva is very sensitive. Risk factors of necrotizing ulcerative gingivitis: poor oral hygiene, of course. A patient with poor oral hygiene will have necrotizing ulcerative gingivitis. Pre-existing gingivitis, if he had gingivitis, okay, he will have necrotizing ulcerative gingivitis. Patient smoking, under stress, malnutrition, doesn't have proper diet, okay, doesn't take his doesn't eat fruits and vegetables and proteins and carbohydrates and so on. So malnutrition, okay, will lead to acute necrotizing ulcerative gingivitis. Also, patients with HIV or human immunodeficiency virus infection will lead to necrotizing ulcerative gingivitis. So let's go to the next treatment. This is really very important. Local measures. Oral hygiene instructions. This is very important. We tell the patient to brush his teeth twice or 3 times a day, okay, and the position of the teeth is very important. The position of the brush is very important. We put the brush at 45 degrees, we bend it 45 degrees, okay, and start brushing slowly from upwards to downwards, okay. um, Also we remove the calculus, okay, or any staining, okay. um, if they have any pockets or so, everything is cleaned up, and then we give the patient metronidazole, which is an anti-inflammatory, which is in the form of tablets, okay, 200 or 400 milligram 3 times a day daily for 3 days if systematically unwell. So this is very important in case of there is inflammation in the gums, okay. So metronidazole is an anti-inflammatory, it's very good. It will help in the healing power, in the healing of the gingiva. So also we can give mouthwashes, okay, mouthwashes like chloroxidine, betadine, any mouthwash with sedatives in order to reduce the pain in the gingiva, okay. And also we advise the patient to use soft brush, okay, because of the bleeding tendency. Advice on management of risk factors, oral hygiene instructions, and nutrition advice. Also, we tell them to eat proper diet. This is very important. I hope that today's topic was of interest to you, and thanks for listening, and goodbye for now. Bye. See you later.